So hi, I'm Dr. Stefana Pecher, the country doc. Welcome to our latest installment of the New England Medical Cannabis Seminar and Support Group. Please welcome our very special guest tonight, Brian Essenter, pharmacist and manager at the Compassion Center in Bethel. Mm-hmm. He drove here 2 hours to get here.
Yeah. Of course, absolutely, no problem. I'm gonna sit for now anyway. Nice to meet you guys. I understand you guys have been doing this for a little while now, so I assume some of you guys have a little bit of knowledge, but kind of what I bring to the table is a little different than what just your basic information would be. I'm just going to start by kind of showing you guys what we do with our new patients and what we do on an intake. Every time a patient is certified by one of the doctors, they come and they make an appointment with us, but their very first time, they have to make an appointment. They have to sit down with one of us and go through the basics. No matter how much they do know or think they know, or regardless, we want to make sure they know the important stuff and the right information. So if you kind of want to follow through in the booklet here, just gives some real basic information at the beginning, the differences between the two main strains that you see, your sativas and your indicas. Kind of explain, which ones are more appropriate for what. Your sativas are your daytimes, indicas are your nighttime, and then your hybrids are what they refer to as your afternoon. Those are the cross of the two different strains. So, and depending on what strains are crossed, they can be sativa dominant, indica dominant. So what that gives us the opportunity to do when we know those things is help people medicate appropriately. A lot of what people get off of the street, you have no idea what it is, what to expect, what the effects are going to be, what it's cut with or sprayed with or not. Whereas what we do is I really kind of refer to it to people as a game changer, because what you get off the street typically is going to be an indica. Indicas are your nighttime, more sleepy, sedating, good for pain and stuff, but not going to help if you need to be functional during the day. You need to be, out and about doing things, be present, be a participant in your life is what we try to tell people we want from it. So, we really try to narrow down what you're looking for and then pick a few products that are going to be appropriate for what you're looking for. But the biggest thing that I tell everybody too is, this is your therapy. We are here for you guys. We are not here to make you take anything you don't want to, use anything in any way you don't want to. We're here to help you improve your outcomes and quality of life. And, as we go through the whole process, people start to understand that it's possible. It doesn't have, all of the stigmas that came with it aren't necessarily appropriate anymore. Because if you look at the next page, it has all of the cannabinoids. The cannabinoids are all the different chemical components of the plant. There's over 110 different cannabinoids in the cannabis plant. But the cannabis that we use is your cannabis sativa and your cannabis indica. Your cannabis ruderalis is your hemp. That's where a lot of CBDs come from over the counter and everything too. It's really, there's no medicinal value to hemp whatsoever. It's a great textile, but anything you're going to get over the counter like that is really not going to give you any significant medicinal value of any sort. But what we can do is really break it down and show you which percentages and everything of each particular cannabinoid we have in each particular product, so we can really get you what you need that way. But the CBD, that's the big one that's been in the news lately and everybody is really talking about. The great thing about CBD is it's non-psychoactive. That's your cannabidiol. That's pretty much your primary cannabinoid that you're going to find in the plants that has the most medicinal effects for people. But it doesn't get you high. It can help with pain, inflammation, muscle spasms, anxiety, depression, has anti-cancer, anti-tumor effects. I mean, it can do most everything. Two things we tell everybody it doesn't do: it won't put you to sleep, and it will not stimulate the appetite. So, a lot of your cancer patients, HIV patients, people that are looking for that appetite stimulation, that's not really going to do anything as far as that's concerned. But you adjust. You use it for what you need, when you need throughout the day. Your CBDs are going to be very helpful for your patients that need a good baseline of that anti-inflammatory relief. CBDs are also very neuroprotective, so they really help significantly in our patients with Parkinson's, MS, ALS. We're really Alzheimer's is finally starting to come on board and everything too. Now, don't get it wrong. We're not trying to say we're healing anything. It's neuroprotective. And really what that does at that point is it helps to slow the progression of a lot of these diseases. It's not going to reverse anything. You're not going to be all of a sudden a genius next week or anything like that. But it really can help. I know, I'm sorry, I don't mean to burst anyone's bubble with that, but it really has all of those effects too. We have had tremendous effects with our cancer patients, very specifically with it too. If you start talking about RSO oil or Rick Simpson oil is what everybody has seemed to come to know it by. It's the CBDs weren't around when Rick Simpson started this back in 1980, I think is when they did the documentary for that. CBDs, they had no idea what it was. It was THC that they were working with. So you consider the dosages that these people were using of THC, they're walking around stoned all the time, basically. Did it work? Yes, absolutely. Is it much safer and healthier than your chemo, which is basically poison they're putting in you? I would say so. But now that we can start figuring out all of the cannabinoids and what they are and how they're working, we're finding CBD is even more successful with that. Together in about a 1-to-1 mixture is really kind of what you're looking for. But you kind of make it so that they can function throughout the day, and that you start with a higher CBD in the morning, and as you go throughout the day, you kind of flip-flop to an equal parts of CBD and THC, and then your THC. Because one of the great things about CBD is it can actually counteract the psychoactive effect of THC. Doesn't eliminate it or anything like that, but if you have CBD dominant products, more of a 5-to-1 ratio, 10-to-1 and above, you're going to be much more clear-headed, much more functional, go on about your normal daily activities. Still get a little THC in there. You get what they call the entourage effect. Whole plant's more effective than the individual chemicals, but not enough that it's going to affect your well-being or your functionality or anything like that. And that's what I tell people about your THC and what we do with that. THC is very effective. It can do a lot of things for you, but that is your psychoactive component. That's what gets you high. So we titrate to 2 things for people. We titrate to relief, or we titrate to your comfort level. How high are you and how high can you handle being, basically. Because a lot of times patients don't get the relief they're looking for immediately. It takes some time to build some tolerance to really get the relief they're looking for to get to those doses. So, over time we build that up, but we want to find out where your limit is so that we can peel it back, stay there for a little while, and then at your comfort level start pushing forward. But again, I tell everybody, my goal is not to get anybody stoned out of their mind. Unless you tell me that's all you want, well, we got something for that. But that is not our goal. That's not what we're here to do. And that's not why people come to see us, and that's not why they trust us the way they do. Your THC, the thing with the THC is great for pain, nerve pain very specifically. Also going to be very good for sleep. Also works very well for anxiety. One of the big things about anxiety that people get very confused is your sativas are your daytimes. Those are your uplifting, happy ones. We don't usually recommend those to people with severe anxiety because they can come with a lot of energy too. With that energy can end up pushing you in the wrong direction, exacerbating a panic attack. We don't want people to have those kind of issues. Much more of a chance to lead to that paranoia, which is basically from too much THC, but energy combined with the anxiety, combined with too much THC, and that's a recipe for disaster. And we want to make sure that, just because it's going to be a more happy, uplifting strain doesn't make people think something and take it the wrong way. And then they end up in a really bad place too. So we usually, for patients with severe anxiety issues, we kind of stay away from sativas in the beginning. Go to something that might be a little bit more sedating, or more CBDs if they need to be more functional and wakeful and stuff during the day too. One of the big ones that we're really learning about right now is your THCA. THCA is your acid. It's your raw version of THC. If you ever look at a bottle, we have some here. Everything in the state of Connecticut too, we're going to sidetrack for a second. Everything in the state of Connecticut is all grown within the state. It's all grown indoors. Everything that they grow gets sent off to an independent lab for testing. Make sure there's no molds, mildews, heavy metals, pesticides. They test for your THC content, your CBD content. So you know what you're getting is exactly what it says it is. It's not sprayed with anything, cut with anything. There's no mold or any of that other mess. And as far as the entire country is concerned, we have the strictest testing policies of anybody. So you know that sometimes people want to complain about cost and everything else. Well, you're going to get that medical quality stuff, that medical grade, product is what you're getting. All grown indoors. Go ahead.
Are any of the products, you mentioned allergies, interactive or bad for people that have severe allergies?
It's really kind of relative. It depends on what you're using and how you're using it there. No, but I'm just saying because it depends on the formulation. If it's just, general allergies, no. But, if you have like a gluten allergy and it's in a cookie, something like that. But I have not heard of anybody having like an allergic reaction or an anaphylactic reaction of any sort like that with it. There is some potential for some interactions with medications and stuff. One of the things about your CBD and THC is they only bind to your CB1, CB2 receptors, which you have over your entire body. They are very plentiful in your brain. Cannabis is very fat soluble, which means it crosses the blood-brain barrier very easily. But the thing is they're not competing with other receptors for that action. So for instance, your opiates patients, your patients that are in a lot of pain, opiates work on your mu receptors. These aren't going to block that or stop that from working or anything like that. They're working on completely different receptors. So our patients will come in and they'll say, oh, I've been taking, the highest dosages of all these opiates. I need the strongest stuff I can get. Okay, great. But we're working with completely different stuff. Consider somebody who's never had a drink of alcohol all of a sudden wanting to drink, 100 proof alcohol. Well, it's not going to take much of anything for them. So, the same idea is there, and we kind of have to talk patients down a little bit from thinking they need the biggest, strongest, greatest stuff in the world. And sometimes it takes a little bit of time to get them there and make them realize what we're talking about, and it's possible to do things a little different. But it's amazing to see the benefits that they can get from it and not have the same withdrawal symptoms and stuff like that, because it can really help to quell those as well. They don't have quite that agitation, the irritation, the jitters and all of that come with it. Is it a rough ride? Yeah. But what I tell our patients on the opiates specifically is you get to a point where you forget you need them. Everybody functions that is usually taking them or has been for years. It's every 4 hours, 6 hours, whatever it happens to be. Well, when you start using this, and if you're doing it appropriately, I don't want anybody going cold turkey on anything. That's bad news. Don't do that. But you start, instead of it being every 4 hours, it becomes every 6 hours, every 8 hours, every 12 hours. And you don't even realize it. I had a guy come in yesterday. He's a new patient for a week and a half now. He's already decreased his opiates by 50% in a week and a half. And he was taking 60 milligrams of immediate release oxycodone a day. And he's already down to 50% of that. And, he said to me, he's like, I think I'm going to be off within the month. I'm like, okay, take it easy. Because I don't want people to get overzealous and do themselves harm as well and put themselves through some really bad withdrawals or bad situations, because some of the worst parts of getting off opiates is your very end. Those last few milligrams is when your body just wants to hold on for everything. So I'm like, take your time. It's okay. I'm so happy to hear that. I get goosebumps when people tell me stuff like that. So, hearing those kind of things is great. That's what we want to hear. But when we're able to get them to use each particular medication appropriately, it helps. But the THCA is kind of where I was going to, and why that is so appropriate, because it's your raw version. THCA by itself does not get you high. It has to be heated in order to convert to THC in order for it to get you high. So it's not psychoactive by itself. So, and if you look at the bottle of the THC on there, it'll show that your THC is a very low percentage typically of what's in the flower. The THCA is the majority of it. So if you were to eat it, juice it raw, anything like that, you'd get the benefits of the THC without the high of the THC. So you don't have to do that. You can, but you don't have to. That's kind of gross. But we have certain tinctures and stuff that we've been using now that we've been able to find patients that have been getting a ton of pain relief. We have a patient that was able to get from, what was he on, 60 milligrams of methadone a day down to, I believe, 7.5 milligrams is what he was down to at last note. And the only reason that he wasn't able to get off completely is because we had run out of one of the THCA products that we had that was really helping him with his pain. One of the biggest headaches we have is our inventory comes and goes. Changes on a daily basis, so constantly have to change things up, go in a bit of a different direction. It's good and bad. There's always something, so we can always find something that'll get you that help. If something's helping you, it's very frustrating to have to find something else, but you may find something that works better. And now we have options going forward as well. So it's a double-edged sword. It's not easy.
Why is that happening? Is it because you said earlier that we can't buy this from any other state. We're growing all of it right in state.
That's for federal law more than anything. You can't transport a Schedule I substance across state lines. Now it becomes a federal felony to do that. So everything has to be grown within the state. So again, double-edged sword here is your growers have a lot of money invested in each one of their operations. They have all expanded to about triple what they started at this point, but we still are, the program is growing faster than they can grow. You're still dealing with Mother Nature. So to grow a flower from, planting it to getting that product out, you're talking 10 months. You have about 6 to 9 months of grow, then you have to let it cure, you have to, whatever type of extractions they're doing, they have to send it off for testing, and then you got to wait for the brand approval from the state as well. So it's a process. So, we have products that come and go because they are just great for what they are, but it's still limited. Every one of the dispensaries gets the exact same allotment of medication regardless of how many patients you have. So if you have 2/3 of the patients of all of them in the state, you still can only get, because there's 9 dispensaries, 1/9 of the medication from any grower. The idea at the beginning was great. It was to make sure that everybody had equal access. You didn't get all of the product just because you had all the money and then everybody has to go see you. But it hurts the patients because if you have all of those patients, but yet everybody else is buying their maximum because it's still barely enough for them to get through, you're constantly grasping at straws to or stealing from Peter to pay Paul because I'm sorry, I don't have anything. I couldn't hold it as long as I said I would because I had a patient who needed it. So now you're having to kind of triage your patients as well as to who needs it more than somebody else, and it's frustrating.
So if it's available at another place, do you need a card for each individual place that you go to?
So yeah, you can transfer dispensaries up to 4 times a year. There's a form that you have to fill out on it's on the state's website. It takes at least 24 hours for that form to go through. So you can, but it's something that, I'm up in Bethel. If I happen to be over at Foxwoods and I want to go to the Thames Valley location, I can't do that tonight. Let's say I'm stuck out here because there's a storm and I can't get home or whatever, and I needed my medication. I can't do that tonight. It's not an option. Good and bad, people aren't, the big reason they do it is because they don't want people coming to me and getting 2.5 ounces, which is your total allotment, and then, the next day, because that's what they get for a month. The next day they go to another dispensary, well, we're not connected, like a Walgreens maybe or something like that, to know that they got their full allotment from me the day before. So they go and they get their whole allotment from somebody else the next day. And they do that to each different dispensary. Before you know it, they're able to have massive quantities, and now you got all kinds of other issues too. So
Isn't it connected now?
no, it's not. We have to upload all of our information to the PMP system. So if you are getting any opiates or anything like that, and you go to a pharmacy and they, check your PMP and your prescription history, they'll see if you're receiving medical marijuana at that point too. If your doctors go and look, they can see. But the problem is the NDC numbers change literally every single time a new product comes out. Even if it's the same strain, the state's restrictions on whether they can keep it the same name or the same NDC number are so finite that they can't do it. So it's constantly getting new names, new NDC numbers. Well, the state can't keep up with the NDC numbers to the company that handles all the PMP system, so it just shows up as medical marijuana on there. So if a doctor looks it up, they don't know what type of a product you got, they don't know really how much you got, how you're using it, what it's for, nothing, other than, yes, you did get a medical marijuana product. So that's the only place that you can see if they've been somewhere else. But we call each other, just like if you're doing a prescription transfer, for a controlled substance, you have to call another pharmacy to find out how many refills are left. Well, how much of their allotment have they used for this month? When's their reset date? All that kind of stuff. We'll speak to each other and we'll get to. But it's not the most convenient for the patients, but it's one of the better quality programs, and the quality of the products that we have are as high as anywhere I've seen in the country. What's that?
Protective.
Yeah, it is. The more regulations, the harder it is to do the job and to get the patients what they need. But the patients want the regulations because they want to know that the product that they're getting is that high medical grade quality stuff. So, it's hard. The growers are trying to do their best to get as much medication as possible to the patients, but you're dealing with Mother Nature. It's a natural product. Not to mention the fact that they might grow something and it might take them 4 or 6 months to grow it, and it might not pass once they send it off for the testing. So if it tests positive for mold or something like that, that's not making it to market. They got to scrap that whole product. So they may have had a backup right there ready waiting to go, but if it doesn't pass the testing for one reason or another, well then, so it's hard to say, hey, listen, I got this coming next week, when it may not pass, so it might not even make it. So now you have your patients that are upset because they thought it was coming and they were holding out and they didn't get something else because that was coming in, and it's...
I never thought of this before, I'm fairly new at this. Do you get, not addicted, does your body acclimate to the amount you're taking and you've got to take higher dosages, or can you pretty much stay on the level you're at?
It's kind of relative. It depends on what you're doing, how you're doing it, and what you're looking for relief. Your body will definitely build a tolerance to it, just like any other medication over time. Depending on how hard you're needing to push through that will depend on how quickly your tolerance grows. Does that make sense? Because if you're not getting the relief you're looking for and you need to keep going, then yes, you're going to push through that tolerant phase till you get there. Now, once you get there, you should be able to plateau for quite some time and stay at that, where you can be functional and get the relief you're needing and everything too. Go ahead.
A couple of quick questions.
Sure.
As a provider,
I think we better pass that microphone.
Oh, yeah.
no, we can hear it.
Well, the
My
TV.
curiosity is when I'm looking at a patient's toxicology screen.
Pass that back to her.
Yep.
Am I going to see anything? Thank you. Am I going to see anything other than THC? Am I going to see any of these other cannabinoids come up positive on a tox screen?
You may. It depends on what the tox screen's testing for, honestly. I'm going to say 99 out of 100 times, they're not testing for anything other than THC, your Delta 9, Delta 8, THC. So that's probably all you're going to see. The thing is when you're looking at a tox screen like that, for CBDs or something to pop up, it's really irrelevant. The only time that I would say that that's relevant is for what we've seen so far anyway, are your epileptic patients. Just because that's where your biggest interactions come from your anti-seizure medications. And what we just have to do is watch it like we do any other interactions, because it's not for the same binding sites receptors, it's the enzymes that break them down. It's a CYP450 that breaks it down. So that's where you can have your your anti-seizure medication start increasing their levels. So if we have that thin therapeutic range, and I'm sorry guys if I'm getting too technical here for some of you, then you have to really be careful of that. But it's usually pretty evident to see if they're getting the results they're looking for from that. One of the things I've learned more than anything is CBD is not the only game in town when it comes to seizures. And just like medications, every single patient is different, and every single one needs a different combination, whether it's THCA, CBDA, CBD, THC, or any combination thereof. So it's hard to figure out that puzzle, just like it is as a clinician, because everybody is so different, and you unfortunately have to go through that trial and error to figure it out. Does anybody else have any other questions? Yeah, go for it.
Pass that microphone, please. Thank you. Thank you.
There we go.
Yeah, you mentioned THCA,
Yeah.
and I was wondering if you could talk a little bit more about it in terms of, you said it works the same as THC in terms of...
Yeah, it's hard because there's not a ton of great information out there about it. What I can tell you is what we've seen over the past 9 months to a year just from the patients that we've used, it really depends on, just like the rest of the medication, your strains that you're getting the products from, what it's really going to be best for. So some of your hybrids are really some of the best ones for the THCA, because the hybrids are your cross of your indicas and sativas. That gives a good function of, body relief, pain relief, and it's not a knockout, so people are still very functional as far as that sedation and everything is concerned. But with the THCA, because you're not getting high, and it is helping significantly, we found with pain and with muscle spasms very specifically, that they're able to get better focus. They're not so focused on their pain and how much that's affecting their life and everything else. And they've been able to get just a better quality of life. They're better able to go out and do more and stuff too. So it's really hard to say. I mean, pain, focus, energy, and I mean, for your THCA, you're not really looking for a lot in the way of indicas as far as that's concerned. Your indicas are really your nighttime's pain anyway. You're kind of looking for more THC typically in that situation because you want that sleepiness, you want more of that sedation typically. If sleep is not an issue for you, well then, yeah, THCA would be a better option, but it wouldn't. Sativas would not be a good idea late night for THCA because they can still give that energy and stuff too. Does that answer any of your question?
Yeah, but that's a great. What's the best way to get it? You mentioned a tincture.
We have a few tinctures, and we do have a couple of oils that it comes in, but those are really the only ways. Because the thing is it's a hard one to extract because most extraction processes decarboxylate THC, which that's the activation of the THCA to THC just by the whole process. So they're figuring out processes every day. The industry is changing on a daily basis as far as how they're doing their extracts, but they're finally getting better ways to get the oils. So at that point it becomes relative to what you're looking for, but you're not going to find it in a vape or anything smokable because at that point, it's getting heated and inhaled. It's going to convert to THC. So it's really tinctures and oils are what we're seeing. I haven't seen it in any tablets or anything like that yet. No, not in the strips. The strips, again, because of the way they make them, it's activated THC. We do have high CBD in the strips as well, which is a good option there. Yes.
Are you hear anything about juicing?
I have. I've heard a ton of stuff about juicing. And the thing is it's just, if you're in a state that allows you to grow your own, then it's a much more economical thing to do. If you're in a state like Connecticut where they don't allow you to do that, to juice your own can get very, very expensive. It's not really worth your while.
Well, as one of the providers, one of the growers, could they create a market in that, do you think?
It's again, regulated by the state as to, yeah, the state won't allow us to make suppositories. So to think that they're going to allow them to make drinks and stuff, they had, what was it that they made us get rid of? There's a couple of different like chocolate covered products they made them get rid of. It's literally brownies and cookies. We can't do any confectionaries, we can't do any gummies, anything like that. No sodas, so like drinks and stuff like that are out because they say that it's too enticing to children, which I get. We don't want that problem. They're actually changing those laws out west right now too, for those exact reasons. Go ahead.
But the reason I ask is because you can get some really high doses of THCA,
Absolutely.
And of course the non-psychoactive effect is there.
That's why there's a lot of people pushing the grow rights and everything in the state too. But it's those are really, because I mean you could juice hemp. You can grow hemp, you can get it and juice it, but there's no medicinal value to that. So that's where the grow rights really come in because you're paying, like for instance, the sublingual strips. Those are not cheap because you're paying for somebody else to prepare that and make it and everything for you. So it's a great option. I've talked to a few people that have been doing it, especially out west. They're doing it a lot more right now. It's just we're limited with what we can use.
One of the biggest problems is that it's natural for the marijuana plant, the cannabis plant, to get infected with all kinds of molds and mildews.
Mm-hmm.
And if you think you can do it yourself and are taking it from someone else who's growing it, you don't know that you're getting a concentrated mold and mildew in the live product that you're consuming.
Absolutely.
So that's where I see it as a real issue because it's a real value.
That's why I say it. Like if you have grow rights, and usually that includes a few plants per person over 18 in the house or whatever, that at least gives you the opportunity to try to do that. And most people can control it themselves. It's a much smaller operation, so it's usually a little bit easier that way. But unless you really know what you're doing with it, it is so difficult. I mean, it's just a very moist plant to begin with, so mold is naturally an issue with it. And that's one of the biggest hurdles everybody has with it as well.
It's the same as growing tomato plants. You get mold and mildew on them.
Right.
And they
Which-
use a lot of chemicals to treat that stuff.
Exactly. And again, that's why doing, a tincture or something that we have that way is really one of your best options.
Mm-hmm. Oh, thanks.
Anybody else? No? Oh, sorry, I didn't see.
Mike. Thank you very much.
Thanks. I have a variety of health issues, and I am in constant pain and have been in constant pain since an accident about 4 years ago. I have avoided the opiates at all costs, even though doctors have prescribed them, because I don't want to deal with that. And so I have been working with the medical marijuana now for a year, say about a year. I still haven't found a balance. It's so frustrating. And at night, that's fine. The indica, that's good.
Okay.
It doesn't make the pain go away. It sort of lurks in the corner in the room. It's sort of a
But it's making it
dissociative.
tolerable.
Yes, and I can sleep. It literally, it's sort of like lurking over by the door type
Right.
thing, and we make lots of jokes about it. But I can't do that during the day and function. And I've been taking a lot of the CBD because that's supposed to help my brain as well, from what I hear, which is great. But it does not help with the pain. It'll take the edge off a little bit, but not enough. And it's sort of like, help! What would you? I need the pain to go away.
Yeah.
Or at least go in the corner.
And that's one of the biggest struggles that we have, and is especially with the pain aspect of things, because CBDs are great. They keep you functional and everything too. But the two biggest issues with CBDs, as far as that's concerned, is number one, it doesn't help nerve pain at all. So all your patients with back pain, with that spinal stenosis, all that kind of stuff, it really doesn't do much of anything for that. It doesn't help migraines really very well at all either. It's a great anti-inflammatory. So as an anti-inflammatory, it can help decrease the inflammation on the spine in certain areas. So it'll decrease the frequency of the shooting of those pains and stuff like that. It doesn't eliminate it. The two things that I've actually heard about the CBDs for those patients is it actually makes them more aware of their pain, which it seems like it's amplifying the pain. I've heard that more times than I ever thought I would. And I think a lot of it is just because of what CBD does. It does help with focus and everything else. It is very clear-headed, but when you are clear-headed, you start focusing on the other things that are going on, and when it's not helping that kind of pain, you feel lost because you still need to be functional and everything during the day. That is really where our biggest thing that we're trying is the THCA for the patients. One of the things that we've really been doing, and I know our dispensary started this before any of the rest of them. We have meetings, all of us, once a month or so, and we talk about a lot of the different stuff we've been doing. And the last time I really was talking big time about the THCA and what we're working with there. Some of the things, because like I said, right now there's only a THCA sativa available. It's not the hybrid that was as good for the pain. There is a THCA spray that's a hybrid. It is not going to help you. It's not going to be strong enough to do what you need it to do. What you can do is there are some of the indica vape refills or some of the indica syringes. You're going to have to talk to your dispensary people about this for which one would be appropriate. But a lot of them are about a 1-to-1 of THCA and THC. So if you look at the bottle, you can actually use it sublingually because it's a pure oil. It's not cut with anything. So as long as there's no peg in it or any of that kind of stuff, it'll still get absorbed well sublingually. So you might be able to adjust the dosing so that you can be more functional, but it's not as heavy because an indica or a hybrid that's getting you that THCA is going to have much better pain relief. You still got to be careful because we're still dealing with THC there too, and but kind of like I was saying, it's one of those things that I hate having to tell my patients, but you just kind of have to keep pushing through. It sucks. It's not the answer that people want to hear or whatever, but it's one of those things where to get to that relief so that it's not just, you're waiting for that to come back, it's hanging out over there, it's just a matter of time, that you want to feel like, okay, cool, I have the day now that I'm good and I'll medicate again later and we'll worry about that then. That's the frustrating part because you're getting relief and you're feeling better, but you want to get over that hump. and it's really just a matter of pushing through, finding that right combination. You know, the 1-to-1 CBD THC tend to give some of the best pain relief I felt during the day for patients. Like I said, the CBD really counteracts a lot of your THC psychoactive effects, so you won't be stoned out of your mind, but you're going to be, you know, it's potential for more head effect there than you would be. But it's easier to get to more pain relief that way and stay more comfortable. Sorry, I'm saying more comfortable, but you know what I'm saying, that you know, you get to that level a little bit easier, smoother. You know, it's not as significant with the psychoactive effect and everything for you that way. And trying some THC, THCA, you know, combinations in there with that too isn't a bad thing. I mean, sometimes it's, you know, it's just a matter of finding the right combination that works for you. But I would really recommend, you know, talking about maybe some like hybrid oils that are a good mixture of THC, THCA. I found that a lot of because we had for a while an oil that was exactly that. It was a 50-50 THC, THCA that was working really, really well too. Obviously, the more THCA, the better off we are with that. But I've been yelling at them for months now to get more of these hybrids and indicas in the THCA, and it's, like I said, it's a battle to get your regular medication. To ask for something that's a little bit more specific like this gets a little harder. But when they're understanding the medicinal benefit and that, you know, this is going to make them look better if they're coming out with these products, you know, first and having them available consistently and in appropriate strains and dosages and everything, it's again, it becomes a game changer for people. It doesn't have to have that stigma attached that the only way for me to get any relief is from getting high. I mean, it doesn't have to be that way at all.
What are the choices? I'm in severe pain. I've got metal plates in my back. You don't want to. I'm sorry. I've got metal plates in my back, and the ones above and the ones below are compressed and degenerated and bone on bone, and they don't want to even touch me. And I'm in just a tremendous amount of pain. I got myself off of pain pills because I just couldn't take the
Congratulations.
effects anymore. But I suffer terribly. So I don't smoke. I have a hard time trying to use products that, you know, I need to smoke. So what are the forms available?
Again, for somebody like yourself, if you're looking for more THCA, you know, the smoking isn't going to get you there anyway. I would recommend going with more sublinguals. You know, the strips, I don't know how effective they're really going to be for you just because the ratios are not easy to get to the right place.
I only use them at night for sleep, and it has helped tremendously. I haven't used them during the day.
Yep, your indicas are great for that. We do have, some of the tinctures are about a 2-to-1. So 2 part CBD to 1 part THC. So that would be something that would be much better.
Is that something you rub on?
Nope, that's just sublingual.
Okay.
And
the tongue.
yep,
Oh,
right
okay.
under the tongue. We also, so kind of a decent time to sort of show you guys what we're doing. So your tinctures come, we have dropper bottles. Let me glue these things down. There we go.
Nice.
So they have spray bottles too. So spray bottles, very discreet for the women anyway. Guys might ask
Now,
a few questions.
You said just a few minutes ago that the spray wasn't as effective, or you're talking
There's
about something
certain,
else?
again, very relative to strains, what THC, CBD, all that kind of stuff, and it depends on what dosages we need to get the relief and everything too. So sometimes, you know, the sprays, you're going to get a same dose every single time. So it kind of gives you that sort of, you know, very simplistic, easy. You don't have to worry about measuring anything out, number of drops or milliliters or anything like that. Just one spray under the tongue, you're good to go, no problem. But that gives you some sort of discretion. You know, you're out and about, you need something quick, you don't have the strips or whatever, just one spray right under the tongue. You know, looks like you got a lipstick, you throw it back in your pocketbook, nobody knows anything. Not that we recommend you use any of this in public or anything like that, but you understand what I'm saying. The tinctures, those are great because, you know, it's a dropper bottle, goes right under the tongue, usually come in either an ethyl alcohol base or coconut oil, MCT oil, something like that. Under the tongue, it gets absorbed 20 to 30 minutes, gives you about 4 to 6 hours worth of duration. That's really kind of where we like a lot of our patients to go, or the formulation we like to use for them, just because you get pretty quick relief and it's a decent duration as well. Stuff like the tablets, you know, those are a hard dose with the tablets. Any edibles take anywhere from 30 minutes up to 2 hours to kick in. They can last you up to 8 hours. You overshoot a dose on something like that, that is a very long, bumpy ride you're not prepared to be on. you can't really adjust your dosing in those so well either. You know, if you have like a cookie or a brownie, you can break it in halves, quarters, but you might be waiting 2 hours for relief. I don't think you're interested in waiting 2 hours to get some relief there. So something like the tinctures or the sprays are much faster acting. You know, with the tinctures, you start with 1 or 2 drops. If it's not enough, you can always do more. You can't do less. So, you know, you start add another drop or 2. It's kind of hard to see how many drops you're doing there too with that sometimes. So that's why, you know, some of the patients really like the oral syringes. Oral syringes I really like for a lot of reasons. They're oral. No needles or anything like that. Again, goes right under the tongue. But you know, you start with maybe a grain of rice on the tip of the finger, just a tiny little bit, and you can adjust it to wherever your needs are. Same thing, again, you know, if it's not enough after 20, 30 minutes, do a little bit more. But you can really adjust these to exactly what you need. The oils, we have a lot of different ratios, high CBDs, 1:1, 2:1. We can really help you adjust, you know, if you have a high CBD one and a high THC one, we can get different ratios that way as well. You can make your own capsules with these too. You get some empty gelatin capsules from a Whole Foods GNC. You take these and make your own edibles with them. You know, that way you know exactly how many milligrams are in each one. If you don't want to take a capsule, you'd rather, you know, make some gluten-free cookies or whatever you happen to like, you know, and it's easier for you to do it that way. Then, you know, people use the oils to bake and you don't have to worry about using the flour. It doesn't have that same, you know, real marijuana taste to it and everything as well. But it just gives a lot of different options with the oils. This is probably where I'd go for you just because you can really adjust it to what you need, and you know, depending on what time of day it is, would give us the ability to adjust whatever you need. The vaping, the smoking, you know, we don't recommend smoking of any sort. It actually says that right in there, and towards the back it'll tell you why. Just because you burn off 50 to 60% just by lighting it on fire, only getting about 12 to maybe 15% absorption. The thing with smoking is everybody knows what it is. Most of the patients that have a clue or have a history with cannabis have been through smoking. It's all reliable. They know what it is, how to use it, what to expect. But you're also getting all the tars. You have all the odor and everything else that comes with it, the lack of discretion. Everybody, ooh, I know what you just did kind of a thing, you know. So with the vaping, much healthier option. With the vapes, what you get is you get a cartridge filled with your oil. And it's oil that you're vaping, it's not the flour or anything like that. Going to get a battery like this. Comes with a USB charger, so fully rechargeable. Any cell phone charger, USB outlet. Batteries are breath activated, no buttons to push or anything either. So as you inhale, it lights up, that's how you know it's working. If it starts flashing at you, it's time to recharge it. But with the vapes, bunch of things that I like about them. Little rubber stopper on the end, take it off, you screw it together, and you're good to go. It's that simple. These have virtually no odor. Unless I blow it right in your face, you have no idea what's going on, so very discreet as far as that's concerned. They kick in 5 to 10 minutes, give you about 2 to 3 hours worth of duration. So if you're looking for immediate relief. Right, that's where I'm getting with this too. And that's the big thing with smoking is you're still inhaling. It doesn't have any of the same effects that smoking does as far as clogging the lungs. There's no tars or anything like that. It actually has bronchodilating effects, so it actually will open the lungs as opposed to constricting them. So a lot of people have issues with coughing. Vape is a little bit heavier than your typical smoke is. But one of the things that I always recommend, each one of the cartridges has about 120 4-second inhalations in it. So if you inhale for 4 seconds at a time, you're going to get about 120 puffs. But the bigger thing is that 4 seconds gives you a way to regulate how much you're using at any given time. So I'll tell patients, count it out. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, stop. If it's not enough, you can always do more. You can't do less. But it gives you a way to make it very efficient. You figure out very quickly, okay, 2 puffs I'm good, 3 puffs is a little too much, we're sticking with 2. But if you need that 3rd puff, it's there. You know how you're going to respond. If you're in that much pain or you're having a panic attack and it's that bad, you're not going anywhere, doing anything at that point. You know you need to sit down, be in a quiet room, whatever it is. But you have the ability to adjust that to wherever your tolerance is, whatever your needs are. And as you build tolerance, you can use more. But as you're inhaling, it will cause you to cough. If the coughing's an issue, do a shorter puff. 2-second puff is going to be a lot less coughing, a lot easier to use. The benefits, it really just gives you very quick acting and very short acting. So like I was saying, with the edibles, they can last you up to 8 hours. You overdo it on that, that is a long, bumpy ride. With these, if you overdo it a little bit, it's a couple hours. Your whole day isn't shot or anything like that. The other thing, if you do overdo it a little bit, grab your CBDs. CBDs will help to calm everything down, recenter everything, really take a lot of that paranoia away, all that edge and everything too. So it's, it's all relative to what you're looking for, and how you're looking to use it. One of the big things about, smoking or vaping very specifically is if patients are looking to get the munchies, you're looking for that appetite, smoking is really the best way to do it. You don't really get it so much from any of the edibles or sprays or tinctures or anything like that. Some, pretty minimal though. If you're looking for that, inhaling is usually the better option. But like you said, it's not easy. Some people really don't take to it very well at all. And a lot of our patients that don't have a history with cannabis tend not to want anything to do with it. They'd rather use the tinctures and the tablets or capsules or the oil, something like that, because it's easier, it's more medicinal, it's a little bit healthier too. So, but it gives everybody options for onset, duration, and whatever you're looking for effect as well, because we have each one of them in high CBDs, 1-to-1s, hybrid sativas, indicas, all kinds of options.
Now, you can tell I don't know much about this. Are there any
Sure.
adverse effects like there are with drugs? I have a long history of adverse reactions to drugs.
It's not anything different than what any of the stigmas would have told you already. In the back of our booklet there, we have some signs and symptoms of addiction. There's less than a 9% addiction rate with marijuana. The thing is addiction is it's a weird thing with it, because they start classifying addiction as you're building a tolerance, you're not accomplishing some of your other things that you would do, it's that stigma stuff. It's people that are getting too high and they're not accomplishing anything else in their life. So like I said, we do everything we can to avoid that. We try to make sure that you're medicating appropriately as necessary throughout the day, so that you're not turning into that stoner that's sitting in the couch eating Doritos, drinking a Mountain Dew, playing video games. That doesn't do anybody any good. But at the same time, I tell everybody too, it's okay to put a smile on your face every now and again. Everybody that we see is in one heck of a terrible position, regardless of why they came in to see me, whether it's their PTSD, their cancer, their MS, their Parkinson's, their epilepsy, whatever it happens to be. That is very stressful on them, on their family, on everybody. And we start with sleep. I want everybody to get a good night's sleep, but I want everybody to have some stress relief too. It's okay to sit down and enjoy a movie every now and again and kind of forget about our problems. Like I said, I don't want anybody stoned out of their mind or doing anything they're not comfortable with, but it's nice to relax sometimes too, and kind of let things go, and that gives your body a chance to just kind of relax too, and you're not so tight and causing more issues with all that anxiety as well. Yes.
Hi, is there any protocol with Lyme and co-infections? Is there anything that marijuana would help
High
with?
CBDs. High CBDs, just because the anti-inflammatory effect. Any of your autoimmune situations like that, where it's just your body attacking itself, comes with a ton of inflammation, which is what starts causing all the issues with the joints and everything else. So we would really just kind of load you up with CBDs. As far as needing anything else for any other pain or sleep or issues like that, we would medicate accordingly. Some THC at night for sleep if the pain is bad, because we don't want to do CBDs much after dinner time. But it would really just be a matter of getting you as many CBDs as we can, as you need to get the relief you're looking for. And the thing is with your autoimmune diseases like that is you really need more long term. It's not something that you're taking for a month and then you stop, because your body is used to that anti-inflammatory effect. So now you stop, and maybe you were only using it for a flare with the Lyme. So maybe we increase the doses during the flare, but you don't want to go cold turkey when you're not in a flare situation. You still want to have a baseline there, so that it's not going to come back as often. Your flare won't be as significant as it would have been before.
Is the CBD oil the best CBD to use?
Usually, yeah, I would say so. Just because most of the time you're going to get a pure oil with it. The capsule's not bad either. The capsules are just your oil in either like a vegetable capsule or a gelatin capsule, something like that. But the oils are usually the healthiest overall way. But it's It depends, because if you start getting to higher dosages with the oil, you don't want to go putting a milliliter under your tongue and having it sit there for the next 20 minutes as it tries to absorb. So at that point, you're better off making your own capsules or something like that. Or we have a lot of capsules too. It's cheaper typically for you to make your own, but we'll give you all the instructions on how to get the right dosing and where you want. And again, if you're making your own, you can adjust it to where, if you are in a flare or something happens, you don't need to, oh no, I gotta run and get more kind of a thing. You adjust on your own.
Just what is it? Is it the THC that's really the helping people with pain? I mean, because it sounds like it's if you're able to sleep at night, it's because you're taking the stronger stuff that will get you stone feeling.
Yeah.
So during the day, I mean, are there patients that have actually been able to eliminate pain with just the CBD oil, or is everybody?
No, there's definitely
it's just
patients
different
that
for everybody.
It's every patient is their own little puzzle. It's that's kind of the fun of it for me, as twisted as that might sound. Is we sit there and we'll just kind of bounce things off each other all the time, and it's so fun to do that because you'll just say talk to me. I need something for appetite, because like I said, our products change from one day to the next, so we're constantly having to figure out what's going to be our best option. Or I tell everybody when they come in, it's a trial and error process. You're not going to like everything that you try, and it's not all going to work for you, even if you did like the delivery method or whatever too. So the more feedback we get from the patients will help to direct us in where we go with suggestions going forward. But it's all very relative to the type of pain they're having. If it's pain from Lyme versus pain from a car accident, and now they're having back and disc issues and stuff like that, we're going to treat it very differently. And we're also going to treat you differently depending on where you are throughout the day, because I had a couple of patients just last week that have a lot of spine issues, but they have no problem sleeping. And I'm like, really? That's just an abnormality? But okay, fine, no problem. We'll work on the other stuff. And so everybody is a little bit different. 99 of your patients that have a disc issues have trouble sleeping, because all day long that pain's just firing. When they lay down is typically when they have some of the best relief, but it's still firing. They're still feeling it, and their body is hurting from all day of what they've been suffering. So nighttime THC, that's where you sleep, and that's where you get some of the best pain relief. So like she was saying, it doesn't always eliminate the pain, but it makes it tolerable so you can get to sleep and stuff too. We don't want patients over-medicating, because you start getting into patients, your MS patients, your Parkinson patients that are more wheelchair-bound, or, walkers, canes, stuff like that. You overdo a little too much indica at night, and they wake up at 2 o'clock in the morning to go to the bathroom because they have some prostate issues too, and they're unsteady on their feet now. We don't need someone falling and breaking a hip. That doesn't help either. So that's where, you might say, I don't want to, vape or anything, but I will always tell patients, I'm going to make suggestions that might be contrary to what you're telling me, but there's a reason for it, and I'm going to explain that. And you don't have to take it. You can tell me, no problem, I appreciate your opinion, but I'm going to go in my direction. And that's fine, as long as you know what you're getting yourself into and what those potential issues could be as well. So again, relative to each patient, but we make sure to explain what that potential ramification could be for.
What do you when you say a trial? Is that like if I was trying something and then a month later it's still not working, and then you switch? Is it a month? Is it 2? Is it like 5 days when you realize something's not working? Is it
usually closer to that? So you go to the doctor, they give you a prescription, and they say call me in 30 days and let me know how it's going. We don't need that. That's what's so different about what we do. Is I'm going to give you some guidelines of how you can adjust your dosing to what is going to be more appropriate throughout the process. So I'm going to give you some guidelines to start as to where you can medicate to, what I think would be most appropriate. And then I'm going to give you, okay, if that's not getting it done, but you're still comfortable and you want to keep pushing through, this is what we're going to do in order to do that. So, I tell all my patients, I don't want to send you home with a garbage bag full of stuff that might last you the next month or 2 months or whatever. You can come and go as often as you need. You can buy as little or as much as you want. You just can't go over your full allotment in a 30-day period. I'd rather you come back and see me after 10 days. Maybe that's a little more inconvenient for you, but rather than have you spend $1,000 on stuff that might last you 2 months, and now after the first week you're like, oh, none of this stuff worked, I didn't like that, you throw it in the corner, and now you don't touch it anymore. So in the beginning, a few different delivery methods, try and figure out which delivery methods we like, which type of products are giving better relief or not. And then we start tweaking it from there depending on what kind of feedback we're getting at that point. But they're not spending too much money that they can't afford to come back, or they're discouraged by that. And they have a few different options, so they know that, well, if I didn't like this and I didn't like that, but this one worked great, all right, cool, we have something we can try going forward in a direction to go in at least.
And then where's the frustration? The last question, I'm sorry.
Yeah.
But where's your frustration level if you get that exact, say she gets the exact thing that she needs and she figures out the combination, and then they don't make that strain anymore? Is that something that hasn't happened? Or
That happens all the time. All the time. It's super frustrating. We are all yelling at the growers all the time, but it's not your prescription medications. This is not Western medication. This is alternative medication. So you can't expect the exact same things that you do from your prescription medications. What we're doing is it's a little bit more of an art form than it is with your prescription medication there too, because and I'm not trying to build myself up to something I'm not. Somebody actually said that to me the other day, and I was like, that's a good way of putting it, because we're constantly having to tweak things. You're constantly having to find something to, fit that same keyhole and unlock that lock there, but you might need to try different keys each time. It's so hard to do that, and I lose it because my patients come in frustrated, and there's nothing worse than saying, I'm really sorry that worked great for you, because I see the happiness and the smile on their face from the relief they're finally getting. For me to have to turn around and tell them, I'm really sorry, but I don't have anything for you, that's my worst nightmare. It's what I hate to do. So it discourages people from the program, from the process, from everything. They're like, well, I got all this and now you can't do it. I'm just going back to the pills. At least I can get them every month and it's not a problem, So that's where my biggest frustration comes in, because that is the last thing that I want to hear from anybody, is that they're just, I can't get what I need. You guys don't ever have what I want. So they go back to the easy, well, there's got to be a pill for that kind of a mentality. Did you have a question, or were you just stretching? You were just stretching? You had a question, sorry.
I was just thinking, though, at the same time, there might be the frustration of not being able to get the exact strain or combination that was the most helpful. There is a record of that, right? So that if it comes in again, and then that's what you're talking about, that in the meantime, that allows you to try for alternatives.
Exactly.
It's like when you go to the store and they don't have your certain brand of something, if you have a backup.
Yeah, well, you go to the liquor store and normally you buy Grey Goose vodka, and they don't have Grey Goose this time, so you got to buy Kettle One or whatever it happens to be. That's kind of the idea, is what we're trying to get, is something very close that can do almost the same thing. It's one of the great things about it is we end up finding other options as well that work well. But what we've gotten to the point that we're doing is we can put notes in the system, and we have a history of everything everyone's ever purchased. So the notes are great, so you don't have to tell your story every single time. We can put in there, patient really likes Hybridol A, or, whatever it happens to be. So that way, if you see a different person the next time you come in, oh, hey, look, I know you noticed you like the Hybridol A, we got that in this week and whatnot. We also have, we finally started doing this because we had sticky notes all over the place for patients that are like, let me know when this strain comes in. And I'm like, I can't do this anymore. This is a mess. And I'm randomly just ripping stuff off of our bulletin board. So we started a binder. Each grower, if you got something that you really want from a grower, let us know. I have no idea when it's going to be available, but at least that way, when it is available, I'll call you and you can come pick it up or not. Maybe you found something else that's working great. If not, now you know, and you can come and grab it as well. So we try to do what we can for those patients, especially the ones that get really upset, break my heart more than anything, because I got into this to help people. Like I said, as a pharmacist, the worst thing in my life was it got to the point where going to work every day was the worst day of my life. You can't help anybody. You don't have time to actually have any effect on patients' outcomes and quality of life. anymore. Your day's spent with the phone stuck in your ear, arguing with doctors and insurance companies about what's covered and what isn't and why. And then the patients want to argue about why it's taking so long and why it costs so much. And then the patient that wants to ask a question gets me with my phone in my ear and a bottle in one hand saying, "What can I do for you?" And you're like, "You know what, never mind, I'm just going to go figure it out on my own because, I can't really pay attention." So for me, when I can sit down and have these direct effect on patients, their outcomes and their quality of life, to see them get that and then come back and not be able to continue with that or at least continue getting there, I lose my mind. It drives me nuts. It's not what I'm used to being able to do. You're used to prescription medications and having that every single time, unless there's a random manufacturer back order or whatever. But that's where some of my biggest frustrations come in. But I've also been able to help patients find better relief with other products too, just as often as we're not. So there's almost always something.
Do you find that people have a rebound inflammation toward the end of their dosing? Should they take it on a regular schedule, or is the as needed the best way to go?
It depends. It depends on the situation. If it's something that is more like autoimmune, kind of like I was saying, then you're going to adjust your dosing for flare-ups and stuff like that. If it's something that you're taking it because see, the thing is our patients, just because they happen to have PTSD doesn't mean they're also not in pain and dealing with all kinds of other issues. So some of the patients, we can help them with a lot of their pain and stuff like that. So your CBDs for more of a acute pain kind of a thing, you sprained an ankle, you hurt your knee type of a thing, they're really good for that kind of stuff. Patients that are going in for surgical pain and coming out, we'll go with more one-to-ones and higher CBDs and stuff like that for them because it can really help with your recovery process and stuff like that too by keeping all the inflammation down. So it's really relative. I can't say that I've noticed any rebound inflammation from not being on it, just because most of those patients in that situation, we really want them on it consistently anyway. It's not something that we would, just be like, all right, you're good, you can stop now, like you would with a steroid taper or something like that.
Okay.
Yeah.
Brian, I noticed in some of the early information that was forwarded, you had touched on, or someone touched on, the potential of some relief of Tourette's with some tics.
I had read some stuff. We've talked to a few patients that it's kind of it's a hard thing because that's very strain specific for a lot of patients. You're usually seeing more hybrids are kind of best for that because they have that good body and mind combo, because for a lot of patients it's sort of a combination of both, whether it's the tics that come with the outbursts or whether it just happens to be tics or whatever it is. If it's more tics and more physical, then we're probably going to go more higher CBD kind of a thing for them. If it's more outburst kind of a thing, then we probably go a little bit more THC, but still want some CBD and everything in there too, because the verbal outbursts are not typical by themselves anyway. It's usually coming with some sort of a physical ailment as well. So typically more of a one-to-one for that functionality kind of a thing. And those patients they medicate more situationally. Because, a lot of patients like that, if they're home, if they're in their comfort zone, it doesn't come out nearly as much for them. Whereas, they're in more of an uncomfortable situation and it's going to be much more pronounced, just that, general anxiety, stuff like that. You can see it more too. But it depends. It depends on how well they can be controlled with medications, because some patients can be controlled amazingly well with medications. Problem with those medications is your side effects. They're usually extremely sedating and everything too with what they're going with to do that for them. So,
yeah. Thank you.
Yeah.
What do you consider a high dose CBD? What is the dosage?
Again, relative to each patient. So what I'll say is the lowest doses of CBD that we really would typically start with anybody is around 10 to 15 milligrams. That's really a low dose of CBD. CBD is very relative. A high dose of CBD, you're talking a couple hundred milligrams, is really high dosages. I've seen that. We do that for a lot of our cancer patients, stuff like that. Some of our epileptic patients might need dosages that high as well. Usually once we start getting to dosages that high though, it starts getting really expensive, and depending on what we're treating, I will usually recommend, trying to figure out a better combination with some THC or THCA in there, because typically that's going to give better relief of the situation than just increasing your CBDs, because CBDs are great, but bottom line for most everybody is it's going to come down to cost as well. And to do high CBDs just because that's a little healthier for you, it's not really cost effective for a lot of patients too. So there's ways of keeping that functionality and staying sober with still getting more THC in there. One of the things I tell our patients all the time too is, you get your 2.5 ounces, 99% of our patients go nowhere near that. We keep an eye on how much you're using and everything in a month. I'll know if you're starting to get down to that full allotment every month because you're just increasing your CBDs and that's all you're doing. And it's like, that's great, but there's probably a way we can help you more efficiently as well. So, not that I'm just tracking everything you're purchasing because I want to spy on your account or anything, but because we could probably help you better, more efficiently financially with the medication, the amount you're using, all that kind of stuff too.
Great, thank you.
Absolutely. Yeah.
On the math like you were just talking about, how much would that cost? That doesn't work.
Again, very relative to how you're using it. Well, it depends on if you're using oils, if you're using flour, if you're using vapes. I would say our average patient spends around $300 a month, maybe $400, depending on what you need, how much you need. And in the beginning, our patients tend to spend a little bit more just because they're trying to figure things out, and you have some stuff that you'll find you don't really like or doesn't work as well for you. So once we start narrowing it down and really pinpointing what's working, it becomes much cheaper and more efficient for you that way too.
That's in Connecticut.
Yeah, everywhere is different. I mean, I know Rhode Island's usually a little bit cheaper because they have a lot of grow rights and regulations are very different and everything too. So it's all very relative as to the availability of the product, the type of product you're getting, and how you're using it as well. Anybody else?
Meetings before, there was a gentleman that was using a spray and went on to say it was for pain. There was a gentleman a few meetings ago that was using a spray in the container.
Yep.
And he was saying he's in a lot of pain. Now that container was blue, and I noticed this one is red. Does that mean? Does the color indicate?
It could just be a different grower.
Oh, okay.
Sometimes, yes. Most of the time, not necessarily. But again, we will give you all of that information. I always finish my little spiel with our patients with, my final line is, now that I've overwhelmed you with all of my information, what is it you're thinking today? What do you, how do you want to use your medication? So, it's very overwhelming with all of the information and everything else. So I tell them, don't worry about sweating the details too much. We will write all of this down for you.
No, I just thought maybe it was two different products.
Well,
so that's
they're
why I
different
asked.
products, but it also can be different growers and stuff like that too. Sometimes, growers will have the same color bottles, but, they're different. So it's not something that I would use to really discern one thing over another unless we specifically tell you on these, if it's yellow, it's sativa or whatever.
Okay, thank you.
Absolutely. Anybody else?
All right.
All right.
Thank you very much, Brian. That was wonderful.
Thank you guys.